could say that my hardest, or at least the most challenging part that uses my brain, is working out what the patient wants and making sure that you're on the same page, because I think you could probably break it down into 3 patient types. The patients who come in, they know exactly what they want, they show you photographs of what they want, they know how much it's going to cost roughly. You can kind of say that you're going to achieve their goals if it's within your clinical expertise. You get patients who come in and say, "Oh, just do what you think." I'm like, "No, you gotta tell me what you want." You sort of have to dig deeper, and if you can't get to that point, you kind of have to be like, "Look, go and have a think about what you want, then come back to me." And there's the third type of patient who's like, "I just want exactly what that person has. I don't want any, I want this, what this other person has." And you have to be like, that person has a different face, different teeth, and then you have to be like, "No, we can't do that." So in short, I think expectations are shifting, sometimes for the better, sometimes for the worse, from our point of view. But also, if they have unrealistic expectations and time scale, and the health of their mouth, they're not looking after themselves maybe the right way, and they expect you to make them look like Margot Robbie. It's a classic one these days. You're like, "I can't do that for you." So it's kind of a double-edged sword.
Which I actually thought it's the perfect scenario for someone saying, "I want to look like them." It was girls who were twins, identical, and I treated one of them who now had composites. Sister comes in, "I want to look exactly the same." Oh dear. Luckily we actually done it digitally with injection mold composite at the time, so it was like, actually I could give her the same teeth.
Copy it,
but she literally had the exact same anatomy, so like the same shapes to her teeth, which is obviously we don't see that in 2 separate people generally. So luckily I was able to actually give her the same teeth, which is crazy.
So in terms of patients' expectations, you can show them what they're going to get. They know what they're going to get, and that's a really nice sort of intro to cosmetic dentistry from a dentist point of view. And for the patient point of view, you know what you're getting before you buy it to a degree. So that's a good way of helping manage the expectations too, massively.